Hello, I'm Dr. Abhay Bhave. I'm a hemato-oncologist at SL Raheja Fortis Associate. I deal with blood diseases. We've got many blood cancers that we diagnose and treat. And since this is a Cancer Awareness Month, I thought this video might be appropriate. We've got many cells in the blood. All these cells of the blood are made inside the bone marrow. So interchangeably, we use the term blood cancer and bone marrow cancer. Bone marrow cancer is a scientific term. Blood cancer is more a colloquial, local term for the common people. Now, blood cancers can be of many types. Just to give you examples, it can be leukemia, lymphoma, myeloma, the three most common ones that we diagnose. Within the leukemia also, there are different types of leukemia. Acute lymphatic leukemia, acute myeloid leukemia, mixed leukemias. Lymphomas are different types, non-Hodgkin's, Hodgkin's, and within that there are subtypes. And myeloma also is a type of bone marrow or blood cancer. I'll divide this into three parts. One part is symptomatology, what a patient should remember. Two, what we do as diagnosticians or as scientists to diagnose the problem. And three is the treatment. Let's look at the first one, symptomatology. We commonly term a symptomatology called type B symptom, where there is fever, which is persistent, not going despite treatment. Weight loss of more than 10% body weight in about 3 months. Night sweats, drenching night sweat where our clothes get wet, and itching on the body. These collectively are called type B symptoms. If we have a patient who has this persistently, we are worried. 2. When there are appearances of lumps either on the neck, in the armpits, in the groin, or there is a feeling of severe tiredness, fatigue, bleeding tendency, spots on the body, spots on the skin, a prominence of the stomach where the liver and spleen are becoming more and more bigger. All these are signs that there's something sinister happening. It needs evaluation. So these are the common symptomatology with which a patient comes to us. Once we see the patient, we do tests to find out what is the possible underlying diagnosis. So CBC tells us whether it's a blood cancer or not, and especially by seeing the blood smear. So feeling for those lymph nodes or those lumps in the neck, groin or armpit, we do a biopsy, and by immunohistochemistry, we can confirm the diagnosis of a cancer. Then we do specialized tests, especially on the bone marrow, to find out which type of cancer, what is its genetic status. And today we've got also something called a next generation sequencing, which goes into the depth to find out which is the gene which is creating us the problem. So we can go to several depths in order to find out exactly which type of cancer and what is the kind of cancer in terms of its risk status. Is it a high risk status or is it an intermediate risk status? Remember, all cancers are not bad. Some cancers, if picked up in the early stage, like the non-Hodgkin's and Hodgkin's lymphoma, are extremely well treated, and we've got people who are disease-free for years. So they will go into what's also called as functional cure. However, if our patients don't come to us in time and they continue to take the symptomatology not with much interest or lightly, then the stage can become advanced and therefore we end up not doing so well. The third aspect which I said we'll discuss is treatment. Remember, today we can't say leukemia. We have to find out which type of leukemia. We can't say lymphoma. We have to find out which type. We can't just say myeloma. We need to go into the depths of it. Why? Because today we have the talent in terms of personnel, in terms of diagnostics, in terms of laboratories, in terms of histopathology, to be able to give a level of diagnostic answers which is comparable to anywhere in the world. With this, we are able to stratify our patients far better in terms of risk and in terms of treatment. Today, we know that there are certain gene mutations, certain cytogenetic changes, certain fluorescent in situ hybridization changes which guide treatment. Not only guide treatment, but also tell us how well we are doing. So therefore, good in monitoring also. Therefore, today, the cancer care in our country has completely been revolutionized with the availability of so many facilities. What we are missing is people coming to us in time. If you come to us in time, we are likely to pick up the diagnosis in its early stage and give the best results with sometimes chemotherapy, sometimes immunotherapy, sometimes a combination of the two, sometimes there are just tablets. Remember, certain cancers like chronic myeloid leukemia is treated with a tablet sitting at home. You heard me. Tablet sitting at home, and they go into complete remission, do extremely well. Previously, we had to transplant such people. Today, we are giving tablets. CLL, chronic lymphatic leukemia, also can be treated with tablets and injections. Previously, we used to give them long term. Today, we give them for a short period of time. Today, we have the ability to give finite therapy for cancers in the past which were infinite therapy. Everything has changed with research that is going on. Multiple myeloma, thought to be an end disease. Nothing could be done for it. Today, we got patients surviving a minimum of 3 to 5 years and even longer post-transplant. Coming to transplant. Bone marrow transplantation can be one very good way to give cure, otherwise we can't cure cancers always. Allogenic stem cell transplantation, where the donor is either a brother or a sister, or a child, or unrelated to the patient, but having the same HLA typing, we can actually save lives. We can give a chance of cure to our patients of cancer. There's another transplant which is called autologous stem cell transplant, as is done in lymphoma and myeloma, where we take out the stem cells of our patient after the patient has gone into complete remission and disease control. We take the stem cells and give it back to them after giving additional chemotherapy. This ensures a better depth of response. We're able to control our disease process far better. So in today's world, when we've got so many facilities and abilities for managing, diagnosing and treating cancer patients, please see to it that if your symptomatology is odd, not recovering, you must meet a local doctor and get referred to a hematologist or a hemato-oncologist or a medical oncologist for further assessment. And we are there to take care of you and see to it that your life becomes better and we give you a good quality of life. Thank you.